Hello, welcome to Whiteboard Learning for the week, and this one is about eye stats, which we run probably, would you say, maybe 20 to 40 a day sometimes at the height of our busyness in all the departments. So we need to understand what we're doing, and what we're going to focus on is the most common things that are on the most common eye stats that we run, not a lot of the special things that are on there, but eventually I'll work my way through that whole section. But let's talk about most of the electrolyte related ones at first, and then we'll see how long that takes, and if it takes a long time, maybe we'll break this up into a couple sections. So the most important thing about the eye stat is to understand what is vitally important to your doctor. And in the immediate sense, the two most important things are glucose and potassium, or K. And so potassium, as we've kind of talked about before, we had a whole section on potassium and its effect on the heart. And so we'll touch on that a little bit, but for more of that, you probably should watch that video. So potassium's symbol is K, and some of that is important for when we talk about how we medically designate when you have too much potassium or too little, and that K will come into play again. Glucose is the other way of saying blood sugar, your blood glucose, blood sugar, and that could also be Bg, so there's lots of symbols for that. So the most important thing about these guys is that when they're messed up, they can cause you to definitely malfunction, your whole body. It's life-threatening. And when we talk about the most important parts of it, it's a low blood sugar that's most important, and a high potassium that's most important. And so that's where I want you to really remember is it's low sugar. And why would that be? Because then you don't have sugar to run your muscles and your brain, and you might seize. You also might be very weak. You might have no blood pressure. So whenever I have a patient who's very sick and is unexpectedly kind of weak and the blood pressure is not good, I always check a blood sugar. And then potassium, when potassium is very high, then it will affect your heart, and it can make your heart pump ineffectively. It can start out too fast, and then it can lead to be too slow, and it'll start to look like that on the EKG, and then your heart isn't pumping very well, and it's going to stop soon. So that brings up these two words, hypo and hyper. And so hypoglycemia is the most important as far as function of your body, and hyperkalemia for potassium is most important for function of your body. So they give you pretty good numbers there for what are the values, but I would say less than 70 and greater than 6 on the potassium scale, or where you start to get to be like, ooh, is this affecting them or not? So let's also just talk about hypo and hyper. Hypo means too low, hyper means too high. So everything we talk about will be a hyper and a hypo in this section. So what would cause you to have low blood sugar? So you could have a really bad infection. You could be septic. You could have Addison's, and that's where your body doesn't have enough cortisol to make new energy. You could be a toy breed that isn't eating well, or vomiting, so not eating. Or you could be a puppy or a kitten. You could be you could have an overproduction of insulin, which is called an insulinoma. And so that's a cancer that puts out too much insulin. Insulin drives sugar into the cells, so that means all your blood sugar is being driven into cells, and it drives your sugar down. You also could be iatrogenically given insulin, right? So we see that a lot with iatrogenic insulin administration from owners for diabetics. So normally your blood sugar would be high, but maybe the pet sitter gave you 3 syringes of insulin instead of 3 units of insulin. Or there's some change in your need for insulin, and so you don't need 3 anymore, you need 1 because of some reason. So these are the common things that happen for hypoglycemia. And so we would be doing an eye stat and then go, uh-oh, the blood sugar's 30, and the doctor needs to know that right away. Now, what would cause hyperglycemia? Well, that would potentially be stress, or you bolused sugar. You might do a dextrose bolus and make it go up, or your pet's on supplement of sugar and now it doesn't need it anymore. It could also be diabetes. And it's usually a greater than 300 if you have diabetes. Because remember, stress can make a cat look like it has diabetes. And then sometimes some patients, like head trauma patients, can have their metabolism kind of screwed up and have a high blood sugar and it not be necessarily a big problem. So then let's talk about a little bit more about potassium. So we went over that hyperkalemia is the bad one. And what would cause that? Well, we know UO cats, urethral obstruction, they can't put potassium out in the urine. We got to get rid of potassium because it is so tightly controlled. Remember, potassium is like 3.5 to 5 milliequivalents per liter. So that's a very tight range, whereas sugar is like 80 to 120. And you can go higher and it's not a problem. And you could really be down at 70, which is what the iStat says is normal, and not have a problem. So much tighter control here. So a UO cat, if they're not able to put it out in the urine, that would be a problem. If you're in anuric or no urine renal failure, that would be one version of that. If you have uroabdomen, so the urine has, your bladder's ruptured maybe, and you're pouring the urine into your abdomen, and so you're not getting rid of it, you're kind of holding on to it, which doesn't make any sense, but that's what happens, right? And then if you're supplementing potassium in KCl and the IV fluids and you've added too much, that might be a reason that you would have too much potassium. Another reason, which is more of a hormonal thing, is Addison's. So in Addison's, the hormones are, the lack of hormones are allowing potassium to stay in when the hormones would normally let it go out. And so they're not letting you get rid of potassium because you don't have the right aldosterone. And then when you want to, you got too much, you ate too much potassium, you can't let it go. So Addisonians have a high potassium. So then what would cause a low potassium in the other situation? So a low potassium, hypokalemia, that would be, if you think about it in reverse, if this is a problem of not being able to get potassium out, this is too much potassium out. So that might be renal failure or diabetes, where you're urinating a lot and you're drawing it out. That could also be out your gut. So if you have vomiting or diarrhea and you're losing potassium that way, that happens as well. And if you have a diuretic, so diuretics work by forcing out sodium, potassium, and chloride out into the urine to draw water with them. And so that's automatically putting you at risk for losing potassium.